This is a metered-dose inhaler, also called an MDI. Many medications used for asthma and/or COPD are delivered through this type of device. Some medications delivered in an MDI require that you prime the inhaler before first use or if you have not used it for a certain period of time. Most instructions tell you to prime 2 to 4 times. This is how to prime your inhaler. Remove the cap and press down on the canister with the inhaler pointing away from your face. Please follow your inhaler's package instructions for specific information. There are different methods for using this device, an open mouth and closed mouth method. We will now demonstrate how to use a metered-dose inhaler with the closed mouth method. First, shake the MDI well to mix the medication and the propellant. Remove the mouthpiece cover. Check for and remove any dust, lint, or other objects that may be in the mouthpiece. Exhale fully. Raise the inhaler to your mouth and make a tight seal with your lips around the mouthpiece. Press firmly down on the top of the canister while you take a deep breath in slowly. After inhaling slowly and deeply, hold your breath for 10 seconds to allow the medication to move down to your lungs. You can remove the device from your mouth while holding your breath. If you need to take a second puff, you should wait about 30 seconds and repeat the process. Shake, exhale, make a tight seal around the mouthpiece, press and inhale, hold your breath. Replace the mouthpiece cap. Always check with your doctor if you have any questions about your medication or use of your inhaler. Some MDIs include counters to help you keep track of how many puffs of medication are left. For MDIs without counters, you will need to keep track of how much is used. For example, if your MDI has 200 doses and you use 2 puffs twice a day, your MDI will last 50 days. Some medications require that you rinse your mouth with water after each use. Check with your doctor if you have questions about whether or not you should rinse your mouth after using your inhaler. Inside the MDI are both the medication and a propellant. Because the propellant can clog the mouthpiece, the MDI holder should be cleaned once a week. Do this by removing the canister of medication from the plastic holder and then remove the cap from the mouthpiece. Rinse only the holder with warm water. Allow the holder to air dry on the counter, preferably overnight. Reinsert the canister in the plastic holder after it is fully dry. The MDI should be stored in a cool, dry location and not be exposed to extreme cold or heat. Please follow your inhaler's package instructions for specific information. This is a metered-dose inhaler, also called an MDI. This is a spacer. Most MDIs should be used with a spacer. The spacer is more effective in delivering medication to your lungs instead of it remaining in your mouth and throat. First, remove the mouthpiece cover. Check for and remove any dust, lint, or other objects that may be in the mouthpiece. Fit the MDI into the end of the spacer. Remove the mouthpiece cover from the spacer. Check for and remove any dust, lint, or other objects that may be in the spacer. Shake the spacer and MDI together. Exhale fully. Raise the spacer to your mouth and make a tight seal with your lips around the mouthpiece. Press down firmly on the top of the canister and take a deep breath in slowly. After inhaling slowly and deeply, hold your breath for 10 seconds to allow the medication to move down to your lungs. You can remove the device from your mouth while holding your breath. If you hear a harmonica-like sound as you inhale, you have inhaled too rapidly. Remember to take a slow, deep breath after pressing down on the canister. If you need to take a second puff, you should wait about 30 seconds and repeat the process. Shake, exhale, make a tight seal around the mouthpiece, press and inhale, hold your breath. Replace the mouthpiece cap. Remove the MDI from the spacer and replace the MDI mouthpiece cap. Please follow your spacer package information for cleaning instructions. This device is called a discus, and it is used to treat COPD and/or asthma. A discus delivers medication as a dry powder and holds 60 doses. We will now demonstrate how to use a discus. First, hold the discus in one hand horizontally. With your other hand, put your thumb in the thumb grip and push it away from you as far as it will go until the mouthpiece appears and snaps into place. Keep the discus horizontal and again with your thumb, slide the lever away from you until it clicks. The medication is now available for you to breathe in. While holding the discus horizontally, turn your head away from the mouthpiece and exhale fully. Do not exhale into the mouthpiece or tip the discus downward. This will result in a loss of the medication. After exhaling, place the mouthpiece between your lips, make a tight seal, and breathe in quickly and deeply through your mouth. After inhaling, remove the discus from your mouth and hold your breath for up to 10 seconds. Close the discus by putting your thumb in the thumb grip and pulling towards you until it clicks. Remember, every time the discus lever is pushed back, a dose is ready to be inhaled. You can monitor the number of doses you have left by looking at the dose counter. Store your discus in a cool, dry place and do not expose it to extreme cold or heat. Because most discus devices deliver inhaled corticosteroids, you need to rinse your mouth with water after each use. Always check with your doctor if you have any questions about your medication or use of your inhaler. This is a RespiMat inhaler. It is a device that delivers a slow-moving mist of medication that is used to treat COPD. Before your RespiMat inhaler is used for the first time, the cartridge that holds the medication must be inserted into the RespiMat inhaler and then primed. To prepare the RespiMat for the first time, do the following steps. With the cap closed, press the safety catch while pulling off the clear base. Be careful not to touch the piercing element located inside the bottom of the clear base. Write the discard by date on the label of the RespiMat. This is 3 months from the date the cartridge is inserted into the inhaler. Take the RespiMat cartridge out of the box. Push the narrow end of the cartridge into the inhaler. The base of the cartridge will not sit flush with the inhaler. About 1/8 of an inch will remain visible when the cartridge is correctly inserted. The cartridge can be pushed against a firm surface to ensure it is correctly inserted. Do not remove the cartridge once it has been inserted into the inhaler. Put the clear base back into place. The following steps are needed to fill or prime the dosing system the first time it is used. Proper priming of the inhaler is important to make sure correct amount of medication is delivered. Hold the RespiMat inhaler upright with the cap closed to avoid accidental release of the dose. Turn the clear base in the direction of the white arrows on the label until it clicks. This will be half a turn. Flip the cap until it snaps fully open. Point the RespiMat inhaler toward the ground, away from your face, and press the dose release button. Repeat these steps until a spray is visible. Once the spray is visible, you must repeat these steps 3 more times to make sure the inhaler is prepared for use. These steps will not affect the number of doses available. After preparation and initial priming, your RespiMat inhaler will be able to deliver 120 doses. Now the inhaler is ready for use. If you have not used your RespiMat for 21 days, the RespiMat should be primed again. If your RespiMat inhaler has not been used for more than 3 days, release 1 puff toward the ground to prepare the inhaler for use. To use the RespiMat for daily dosing, hold the inhaler upright with the cap closed to avoid accidental release of the dose. Turn the clear base in the direction of the white arrows on the label until it clicks. Flip the cap until it snaps fully open. Breathe out slowly and fully and then close your lips around the end of the mouthpiece without covering the air vents. Point the inhaler to the back of your throat. While taking in a slow, deep breath through your mouth, press the dose release button and continue to breathe in slowly for as long as you can. Hold your breath for 10 seconds. Close the cap until you use your inhaler again. The RespiMat has a dose indicator which shows approximately how much medicine is left. When the pointer enters the red area of the scale, there is enough medicine for 7 days. This is when you should refill your prescription. Once the inhaler has been opened, it is only effective for 3 months, after which it should be thrown away.